typical eyelid surgery patient might be someone who's older than 40 or 50. They have a lot of excess skin that hoods down on them. Often it's genetic, so they often tell me that, oh, my mother had it or my father had it, and it's often there's a genetic component to it. And over time, the skin over the upper eyelid stretches and quite often it can actually come down like a curtain to obstruct your vision. And in those cases, you can have a visual field test to prove that there is a medical need for this operation because you get a lift and an improvement in vision. And that, of course, crosses over into the aesthetic component of it. One of my patients, had quite a heavy, hooding and objectively on a photograph, she looked angry. She told me she wasn't. And that affected how she related to people at workplaces. And not to cave into that social pressure, but if there was a good crossover of functional component and you do an eyelid surgery that is done well and that has all the risks and that can be quite safely managed, and it leads to an improvement in outcome, often what patients are really happy about is that people ask me, have I been on a holiday? Or sometimes if you've got a new partner, so the same reason people look at these people and throw that inappropriate comment, are you tired? Why are you tired? They can't work out after surgery why they look refreshed and why they look more rested. So it's not typically, in my experience, it's not kind of operation that patients go back into their workplace or whatever and they say, oh, you've had plastic surgery. It's more they look brighter and refreshed. And that's a common operation, and in fact, number one operation, in more aesthetic and I guess in the facial aesthetics of my practice.